So I would knock and then wash my hands. My name is Mariola. I'll be your nursing student today. I'm here to do a physical exam on you. Is that okay? And then can I get your name and date of birth? And then I would check my patient's ID band. Okay, my patient appears the stated age, relaxed facial expression, no signs of distress, and they have a calm behavior. And then I would assess their level of consciousness. So my patient's alert and oriented to person, place, time, and situation. So then I have taken all vital signs prior to the start of the exam, and all vital signs are within normal limits. And then I would start off by inspecting my patient's head and face. So their head is a normal shape, their face is symmetrical, and then their face and lips are a good color for my patient's ethnicity, and everything is moist. And then I would just look at the scalp and hair condition. So the scalp looks normal, the hair looks evenly dispersed, which is good. I would then look at my patient's neck. So my patient's neck is symmetrical. Their shoulders are even, trachea and substernal notch are midline, so that's good. I would then have my patient perform range of motion. So I would have them look to the left, to the right, up, and then down. So they were able to do that, so they have good range of motion. I would palpate the carotid arteries, so one at a time. So I'm gonna start off on the left one, 80 beats per minute, regular rhythm +2. And on the right, 80 beats per minute, regular rhythm +2. And then I would palpate my patient's lymph nodes. So it's the pre-auricular in front of the ear, post-auricular behind the ear, occipital at the back of the head, tonsillar, submandibular, submental, anterior cervical, and then posterior cervical. So all lymph nodes were non-palpable and normal. I'm then going to just go back up and palpate my patient's head. So I'm feeling for any masses or tenderness, which I don't feel anything, so that's good. And then I'm going to look at my patient's eyes. My patient's eyes are normal alignment and position. I would look at the lacrimal sacs for any drainage, which I don't see any. I would pull down on the bottom eyelid, and I can see that my patient's conjunctiva is pink on both sides. The sclera is white on both sides, so that's good. I then would check, I would see that their eyebrows, eyelashes, and eyelids are also all normal. And then I would check their eyes with my pen light. So I'll start off on the left eye. I'll shine the light in one time, and then I'll shine it in a second time while comparing it to the right eye. And I'll do the same on the other side. I'll shine it into the right eye, and then I'll shine it in a second time while comparing it to the left eye. So my patient's pupils are equal, round, reactive to light, and accommodating. And then I would check my patient's extraocular movements by having them follow my pen light. Okay, so my patient was able to follow my pen light, so that's good. I'm then gonna move on to the ears. I'm gonna identify the auricle, lobule, and the tragus on both sides. So auricle, lobule, tragus. I then would look inside my patient's ears, looking for any lesions or drainage, and I would check on both sides. So no lesions, no drainage. That's good. And based on the conversation so far, my patient has good hearing. They're able to respond to what I'm saying. They're able to understand what I'm saying, but I would also check their hearing acuity by performing the whisper test. So I would have my patient cover the ear on the side that I'm standing on, and then I would whisper like 3 words or 3 letters like cat, house, yellow, and then I would have them repeat that back to me. So my patient was able to repeat that back, so they have good hearing. I would then move on to the nose. I would check for patency and flaring by kind of pressing down on my patient's nostril and having them breathe in and out through the other nostril. So that was good. And then I'm gonna look at the mucosa in the nose. The mucosa is pink and moist, so that's good. There are no septal deviations and no drainage. And then I'm gonna look inside my patient's mouth. I'm looking at the buccal and sublingual mucosa, which are pink and moist. The hard and soft palate are pink and intact. The uvula is midline, tonsils are symmetrical. There are no loose, decaying, or missing teeth. The gums are a light pink color, which is good. And my patient does not wear any dentures. So then I would move down. I could see that my patient's mode of breathing is through the nose, which is good. There's no use of accessory muscles, no retractions, there's no presence of cough or sputum, which is good. I would then check for jugular vein distension by having my patient lie flat on their back. And then I would raise the head of the bed 45 degrees. The vein should disappear. So for my patient, the vein did disappear, so they don't have any jugular vein distension. I would then just kind of inspect the chest. I see that their chest is symmetrical and it is a normal shape, which is good. I'm then going to palpate the chest. So I would use my finger pads and a little bit of my fingers to kind of just press down on the chest. I'm feeling for any masses or tenderness or crepitus, which I don't feel anything, so that's good. I would then palpate the cardiac landmarks. So I'll start off at the aortic at the second intercostal space right of the sternum, move to the pulmonic, second intercostal space left of the sternum, to the Erb's point, third intercostal space left of the sternum, tricuspid valve, fourth intercostal space left of the sternum, and the mitral valve, which is the fifth intercostal space at the midclavicular line. So I did not feel any heaves or lifts, which is good. I would then check for thoracic expansion by putting my hands on my patient's chest and having them take a deep breath, so my hands moved symmetrically and at a normal depth, which is good. And I would also do this posteriorly as well. I would then palpate my patient's peripheral pulses. So I'll start off at the radial bilaterally, so 80 beats per minute, regular rhythm +2. I'm gonna move to the femoral, so 80 beats per minute, regular rhythm +2. The popliteal behind the knee, 80 beats per minute, regular rhythm +2. Posterior tibial, 80 beats per minute, regular rhythm +2. And then the pedal on the foot, 80 beats per minute, regular rhythm +2. So that's good. I'm then going to check my patient's capillary refill on all 20 digits. So I'll start off on the hands, and I'll just kind of give each fingernail a little squeeze. And then on the feet as well. And it looks like the capillary refill is less than 2 seconds, showing good tissue perfusion. I would then check the temperature of my patient's extremities. So I would check all extremities, and it seems like my patient's temperature of their extremities is warm. I would then go back And I'm going to auscultate the lung sounds using the ladder technique. I'm gonna start off above the clavicle. So 1 to 2, 2 to 3, 3 to 4, 4 to 5, 6, 7, 8, 9, 10, and then I would listen laterally, and then I would also listen to my patient's lung sounds posteriorly. I did not hear any adventitious lung sounds, and their lung sounds are clear bilaterally. I would then auscultate my patient's cardiac landmarks. So I'm going to start off at the aortic, which is the second intercostal space right of the sternum, move to the pulmonic, second intercostal left of the sternum, down to Erb's point, third intercostal left of the sternum, tricuspid valve, fourth intercostal left of the sternum, and the mitral valve, the fifth intercostal space at the midclavicular line. I didn't hear any abnormal heart sounds, no murmurs, no arrhythmias, everything sounded normal. All right, so then I would move on to my patient's abdomen. So I see that my patient's abdomen is flat in contour. It's a normal shape, symmetrical. I see no scars, no striae, no petechia, no visible pulsations, no masses or bulges. I'm gonna start off by listening to my patient's bowel sound. So I'll start off in the right lower quadrant. Once I hear a bowel sound, I can move on to the next quadrant. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. All right, and the patient's bowel sounds are active, but they're normal, so that's good. I then would palpate my patient's abdomen, starting off again in the right lower quadrant, working clockwise. I'm feeling for any masses, tenderness, or pulsations. So I did not feel any masses, tenderness, or pulsation, so that's good. I would then inspect my patient's genitals. I can see that their tissue color is normal for their ethnicity. The tissue is healthy. There's no discharge, skin breakdown, or lesions. My patient's urine color is a light yellow and clear, and their stool is brown and formed, which is good. Put that down, and then I would have my patient stand up, and I would observe their gait. So I see that their posture is good, their gait is even, gait is symmetrical. I would check for spasticity, tics, or tremors, which I don't see any. And while my patient's up, I would have them perform the Romberg's test, where I would have them kind of stand with their feet close together for 30 and close their eyes for 30 seconds. My patient's test was negative, so I could have my patient lay back down. And then now I would check my patient's extremities and joints. I'm looking for any masses, tenderness. I'm also looking to see if everything's symmetrical, which it looks like all of my patients' extremities and joints are symmetrical, so that's good. I would check edema on the bony prominence. Edema is absent. I would then check my patient's skin condition posteriorly and anteriorly. And so far from what I've seen, my patient's skin color and texture are uniform throughout. Skin is dry, but it's not flaking, so that's good. Then I would assess my patient's strength of their hands. So I would have them squeeze on my hands, pull on my hands, and then push down on them. So they have good strength in their hands, and it's symmetrical bilaterally. In the feet, I would have them push against down on my hands as if they're pressing on a gas pedal, and then pull up against them. So their feet strength is also good and symmetrical bilaterally, so that's good. And then I would have my patient perform range of motion, so they could just follow along to what I would be doing. So pronation, supination, flexion, extension, abduction, adduction, and then circumduction. And then I am finished with my physical assessment. Is there anything else I can do for you before I head out? No? Okay, and then here's my patient's call light within reach, and I'll be back to check on you in 30 minutes.